Dr. Joel Saylor of Town and Country Veterinary Clinic, State Road 100, just up the road a piece from the radio station, comes by our station every Monday, Wednesday, and Friday. And we do pet tips as part of Eagle Eye News at 7. This week we're going to be talking about seizures. Good morning, Doctor.
Yeah, good morning. Yeah, we're actually coming up on our 15th year doing this.
We've been doing it. We're going to keep doing it until we get it right.
Till we get it right, exactly. Yeah, I want to talk about seizures a little bit. Seizures, I always tell clients that the two worst things you can watch your dog go through is, one, being hit by a car, and number two, having them go through seizures. Because the very first time you see a grand mal seizure, you remember that. It leaves a big impact. It's very frightening. And so I want to talk a little bit about seizures, what are the most common causes of seizures. And for dogs, the most common cause of seizures is epilepsy. Okay, what we'll call idiopathic epilepsy, which means we're idiots and we don't know the pathology of it. But basically, it's a black box. And so that is a naturally occurring thing, and there are certain dogs that have the predisposition of that. Now, that having been said, there are certain toxins and things that can cause seizures. Okay, so for instance, you might not have an epileptic, but if they had some kind of head trauma as a puppy, then that could contribute towards seizure activity later in life, and that would be almost more of an acquired epilepsy, not a naturally occurring one that we would see. Or, for instance, if you lived in South Florida and your dog ate a Bufo Marinus toad, those will cause profound seizures. And there are also other chemicals, insecticides, things like that can cause seizure activity or tremor activity. So the first thing that we do when we have a shake and bake dog come in, is that basically, one, we try and shut down the seizure activity. If they're in an active seizure, we got to shut that down. Okay, the next thing we're going to do is we're going to pull blood, and we're going to see if there's any metabolic causes. And we're probably going to quiz the owners quite a bit on, did they get into anything? Are there any medications? What's the house sprayed? What kind of critters are running around? Do you have toads, et cetera, et cetera? And so we're going to have these questions asked and get the answers back. Most of the time when we have epilepsy, we get the blood work back, and we have very little changes on the blood work. And then epilepsy really is a diagnosis of exclusion. You exclude everything else, and what you're left with is epilepsy. And that is probably about 98-99% of our seizuring patients that we see. If we do see seizures present in really young animals, i.e. under a year or even under 6 months, those can be developmental problems, and those are not necessarily epilepsy per se, idiopathic epilepsy, but some congenital defects, and so those need to be worked up a little more stringently. The good news is, if you have an epileptic dog, most epileptic patients are very well maintained on simple medication regimens that are no more invasive than a pill twice a day. And the good news is, most of the drugs that we treat epilepsy with are very cost reasonable, and so it's very simple, because most of these epileptics are diagnosed at about 2 to 3 years of age. Okay, and so you're going to be on drugs for quite some time. Also, too, I will say this, is your veterinarian, just because your dog seizures one time, they may not choose to put your pet on a medication for that with just one seizure, because a dog that seizures for about 2 minutes once every, say, 6 months, it's not worth putting them on prevention, because they're not driving cars or heavy machinery. So have those questions, and of course with anything, if you see anything like that, check your veterinarian and ask the questions you need to have asked.
All right. And hey, we'd like to say hats off to our video producer and lighting technician. Every once in a while we like to bid her hello. Her name is Tiffany Reese. I don't think we've ever said her last name on the radio. You're not running from the law or anything, are you? Tiffany Reese.
We cleared that up.
Okay. We'll be back right after this message.